Ready to soundtrack your summer? With Red Bull Summer All Day Play, you choose a playlist that fits your summer vibe the best. Are you a festival fanatic, a deep-end DJ, a road dog, or a trail mixer? Just add a song to your chosen playlist and put your summer on track. Red Bull Summer All Day Play. Red Bull gives you wings. Visit redbull.com/brightsummer ahead to learn more. See you this summer.
Plan B is a backup birth control option that's there for you when things don't go according to plan. It specifically works after unprotected sex and before pregnancy occurs by temporarily delaying ovulation. Plan B is available nationwide at all major retailers and through delivery apps like DoorDash. No ID, prescription, or age requirement. It's the #1 OBGYN recommended brand of emergency contraception, and it won't impact your future fertility. That's freedom to be. Use as directed.
So good, so good, so good.
New markdowns up to 70% off are at Nordstrom Rack stores now. Stock up and save big on shoes, tops, dresses, accessories, and more must-haves for summer. Join the Nordy Club to unlock exclusive discounts, shop new arrivals first, and more. Plus, buy online and pick up at your favorite Rack store for free. Great brands, great prices. That's why you Rack.
Hey everyone, Chris here from MedPrep to Go, and welcome to another episode of our USMLE Step 1 Questions podcast. In this episode, I'll be reading 3 more physiology questions from our online qbank, and as always, you can read these questions and more at medprep2go.com. And with that being said, let's get started with question 1, Physiology 10. A 7-year-old boy presents with his father to their pediatrician to discuss severe nightmares which have been occurring intermittently for 6 months. The father states that roughly once per week, his son starts screaming 2 to 3 hours after going to bed. The boy does not seem to respond to his father's commands during these episodes, which ultimately self-resolve after a few minutes. The boy has no recollection of these events. Past medical history is unremarkable, and he does not take any medications. Vital signs are within normal range, and physical examination reveals age-appropriate physical and emotional development. Which of the following features would most likely be present on EEG at the time when the patient's episodes occur? Is it A, beta waves, B, delta waves, C, K complexes, D, sleep spindles, or E, theta waves? And the correct answer is B, delta waves. Delta waves are large, high-voltage waves and are a feature of the N3 stage of sleep. N3 sleep is the deepest stage of non-REM sleep and is the stage in which sleepwalking, night terrors, and bedwetting typically occur. It is important to distinguish night terrors, which are not remembered and occur during N3 sleep, from nightmares, which are remembered and occur during REM sleep. Answer choice A, beta waves, is incorrect. Beta waves are high-frequency, low-amplitude waves that are a feature of REM sleep. REM sleep is the stage in which dreaming occurs. Beta waves are also present on EEG during periods of wakefulness. Answer choice C, K complexes, is incorrect. K complexes are low-frequency, high-amplitude waves and are a feature of the N2 stage of sleep. N2 sleep is also characterized by sleep spindles. Which brings us to answer choice D, sleep spindles, which is incorrect. Sleep spindles are high-frequency crescendo-decrescendo waves and are a feature of the N2 stage of sleep. N2 sleep is also characterized by K complexes. Answer choice E, theta waves, is incorrect. Theta waves are a feature of N1 sleep, which is also known as relaxed wakefulness. Key learning point. The N3 stage of sleep is characterized by delta waves and is the stage of sleep in which sleep terrors, sleepwalking, and bedwetting occur. A common mnemonic used to associate waves with sleep stages is bats drink blood. B for beta is awake. A for alpha, eyes closed, not yet asleep. T for theta is N1. S for sleep spindles is N2. D for delta is N3. And B for beta is REM sleep. Question 2, Physiology 11. A 62-year-old woman with a history of hypertension and stage 4 chronic kidney disease presents for a routine nephrology follow-up. She denies palpitations, muscle cramps, or weakness. Her medications include lisinopril, furosemide, and calcium carbonate. She has not had any changes in her diet. Vital signs are within normal limits except for a blood pressure of 135/85. Physical examination is unremarkable and there is no peripheral edema. Laboratory results reveal a serum potassium of 5.8, sodium of 138, and creatinine of 2.8. An electrocardiogram shows peaked T waves but no arrhythmias. Which of the following physiological mechanisms is most actively involved in compensating for her elevated serum potassium to prevent severe hyperkalemia? Is it A, decreased sodium reabsorption in the proximal tubule, B, enhanced bicarbonate reabsorption in the distal tubule, C, increased aldosterone secretion, D, increased atrial natriuretic peptide secretion, or E, reduced renin release from juxtaglomerular cells? And the correct answer is C, increased aldosterone secretion. Chronic kidney disease reduces the kidney's ability to excrete potassium, increasing the risk of hyperkalemia, particularly in more advanced stages of CKD. The patient's mild hyperkalemia and ECG changes showing peaked T waves indicate a need for compensatory mechanisms to maintain potassium homeostasis. Aldosterone, secreted by the adrenal zone glomerulosa, acts on principal cells in the cortical collecting duct to upregulate sodium-potassium, ATPase, and epitheliosodium channels. This promotes sodium reabsorption in exchange for potassium secretion into the urine, serving as the primary renal mechanism to counteract hyperkalemia in CKD. In this patient, despite lisinopril partially suppressing aldosterone, residual aldosterone activity is critical for potassium excretion, especially in early-stage hyperkalemia before distal nephron function is severely impaired. Answer choice A, decreased sodium reabsorption in the proximal tubule, is incorrect. This would lead to increased sodium delivery to the distal nephron, potentially enhancing potassium secretion indirectly. However, in CKD, proximal tubular sodium reabsorption is often impaired due to reduced nephron mass, contributing to volume depletion rather than serving as a compensatory mechanism for potassium. This would exacerbate hypovolemia, reducing renal perfusion and worsening potassium excretion. Answer choice C, enhanced bicarbonate reabsorption in the distal tubule, is incorrect. Enhanced bicarbonate reabsorption in the distal tubule occurs in CKD to compensate for metabolic acidosis, which results from impaired hydrogen ion excretion. While acidosis can shift potassium extracellularly, worsening hyperkalemia, bicarbonate reabsorption does not directly regulate potassium levels. This mechanism addresses acid-base balance, not potassium homeostasis. Answer choice D, increased atrial natriuretic peptide secretion, is incorrect. Atrial natriuretic peptide, ANP, is released in response to atrial stretch from volume overload, promoting natriuresis and diuresis by inhibiting sodium reabsorption in the collecting duct and suppressing aldosterone secretion. In chronic kidney disease, ANP may be elevated due to fluid overload, but this reduces potassium excretion by decreasing aldosterone, potentially worsening hyperkalemia without compensating for it. Answer choice E, reduced renin release from juxtaglomerular cells, is incorrect. In chronic kidney disease, renin release from juxtaglomerular cells is typically increased due to reduced renal perfusion and effective circulating volume. This activates the renin-angiotensin-aldosterone system, leading to aldosterone-mediated potassium secretion. Reduced renin release would decrease aldosterone, worsening hyperkalemia, and is not a compensatory mechanism in this context. Key learning point: aldosterone-mediated potassium secretion in the cortical collecting duct is the primary compensatory mechanism to prevent severe hyperkalemia in chronic kidney disease. Renin-angiotensin-aldosterone system, RAAS, activation drives this process, but ACE inhibitors like lisinopril may blunt it, necessitating close monitoring of potassium levels.
Expedia and Visit Scotland invite you to come step into centuries of history that await in Scotland. Castles steeped in legend walk along cobblestone streets. Come share the warmth of stories passed down through generations. This is a place with a past that is fully present today and all yours to explore. Plan your Scottish escape today at expedia.com/visit Scotland.
Bonjour, compadre. It's the
Priceline Negotiator.
How do I negotiate so many great travel deals? My greatest gadget, the Priceline app. It's got hotel deals, flight deals, rental car deals, all of those deals in a bundle. Deals, game day deals, concert trip deals. No one deals more deals than Priceline. Hold your horses, there's more. The app lets you filter hotels by neighborhood, vibe, star level, and amenities like pools and spas and beachfronts and... Wait, I'm not done. Stop cutting me off.
Priceline.
Question 3, Physiology 12. A 22-year-old man presents to the clinic for a routine physical examination. He has no significant past medical history and doesn't take any medications. He is 6 foot 5 inches tall and weighs 165 pounds. On physical examination, he is noted to have remarkably long, slender fingers and an arm span that is significantly greater than his height. He has a mild inward deformity of his sternum. Slit lamp examination reveals a superior and temporal displacement of the crystalline lens in both eyes. Auscultation of the heart reveals a high-pitched, blowing, diastolic murmur heard best at the right upper sternal border. Which of the following is the most likely underlying genetic defect in this patient? Is it A, cystic medial necrosis, B, defect in collagen type 1, C, defect in collagen type 3, D, mutation in the FBN1 gene, or E, mutation in the FGFR3 gene? And the correct answer is D, mutation in the FBN1 gene. This patient presents with the classic constellation of findings for Marfan syndrome, an autosomal dominant disorder of connective tissue. Key features include a Marfanoid habitus, meaning tall stature, long extremities, and arachnodactyly, pectus excavatum, meaning the inward chest deformity, and ectopia lentis, meaning specifically superior or upward subluxation of the lens. The diastolic murmur at the right upper sternal border is characteristic of aortic regurgitation, often resulting from aortic root dilation. Marfan syndrome is caused by a mutation in the FBN1 gene on chromosome 15, which encodes fibrillin-1, a glycoprotein that serves as a scaffold for elastin and regulates TGF-beta signaling. Answer choice A, cystic medial necrosis, is incorrect. While cystic medial necrosis is the classic histological finding in the aorta of patients with Marfan syndrome, which is characterized by the loss of smooth muscle cells and fragmentation of elastic fibers, it is a pathological consequence of the disease rather than the underlying genetic defect. Answer choice B, defect in collagen type 1, is incorrect. Mutations in the COL1A1 or COL1A2 genes, which lead to defects in type 1 collagen, result in osteogenesis imperfecta. This condition typically presents with multiple fractures, blue sclera, and hearing loss, rather than the skeletal and ocular findings seen here. Answer choice C, defect in collagen type 3, is incorrect. This is the underlying defect in the vascular type of Ehlers-Danlos syndrome. While these patients can have joint hypermobility and are at risk for arterial rupture, including aortic dissection, they do not typically exhibit a Marfanoid habitus or ectopia lentis. And answer choice E, mutation in the FGFR3 gene, is incorrect. A gain-of-function mutation in the fibroblast growth factor receptor 3 gene, FGFR3, leads to achondroplasia, which is the most common cause of dwarfism. This presents with short limb stature, not the tall stature and long extremities seen in Marfan syndrome. Key learning point. Marfan syndrome is an autosomal dominant connective tissue disorder caused by a mutation in the FBN1 gene on chromosome 15, encoding fibrillin-1. It is characterized by Marfanoid habitus, superior ectopia lentis, and life-threatening cardiovascular complications such as aortic root dilation and dissection due to cystic medial necrosis. And that will conclude this episode of our USMLE Step 1 Questions podcast. I hope you enjoyed it and found the information useful. please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read other Step 1 questions at medprep2go.com. Happy studying!
This Father's Day, when you ship UPS Air at the UPS store, your items arrive on time or your money back, guaranteed at no extra cost. It's like the father of all shipping services. It shows up to the airport way too early, just to play it safe. It's overprotective about all the things that truly matter, and it's always prompt, especially to be with family. Make it your first choice to celebrate your dad. Ship UPS Air with our money-back guarantee, exclusively at the UPS Store U.S. retail locations. Visit the upsstore.com/airshipping for full details. Terms and conditions apply.